it's really meaningful in a time of illness to be an active agent in your healing and your health. Sometimes a lot of people feel that they have lost control, and it's a very distressing feeling to have. And when they come to POP, they not only get our support, but they also feel like, hey, I can do this. I have it. I have what it takes. POP Clinic is the crew in the pit stop at the F1 race. So we're not going to be racing, but we are the ones to get you in tip-top shape so that any patient who goes for surgery, whether it be cancer or non-cancer, can really be in the best shape they can be.
I found out about my diagnosis. First I had a colonoscopy, and the physician came to me after the colonoscopy to tell me that I needed a resection. From there, I was sent to pre-op evaluation. Everybody was on the same track. Let's do this. It didn't take long before they convinced me that it was a good thing. I thought it was brilliant.
When you come to POP, we have a look and see whether or not you're going through neoadjuvant therapy. So are you going to get chemo or radiation therapy prior to surgery? And we work that all into a plan, okay, that respects not only the cancer, but the surgery and where you're at. So the big thing that we push is protein. Protein is what we use to recreate tissues and to heal. And if you don't have enough muscle mass, what's going to happen is the body starts taking from the muscle, which means that your function comes down. So you're less strong, you're less able to do the physio or to get up again. And so it becomes a spiral, and we don't want that to happen. So the number one thing is to make sure that we develop a good reserve of muscle so that you'll have the building blocks you need to heal well after surgery and function.
Patients often come with pain, often come with frailty and limited endurance or limited strength. So my job is to make them do the exercise and get stronger.
At the end of the month of doing exercises every day and coming to the clinic twice a week, I realized that I had gained not fat, but muscle mass. I had six pounds of muscle mass added to my body.
We have been charting and looking at the patients who have come through, and the first thing that jumps out at us is that the length of stay in hospital is significantly reduced, almost up to 50%. So if you were told that you may usually need to stay for 5 days, you're likely to get out after 3 days if you come to POP. And if you're supposed to come for 3 days, some people have left after 36 hours post-op. So it's a really rewarding experience to see some of our participants, see them up on the ward and see them up ready to go. They know what to do, they know what to eat, they know what exercises to do, and they know how to get back on their feet. We also know that people for, more than 8 weeks after surgery are much more likely to be functioning physically at the levels that they were prior to the surgery, much more so compared to people who did not go through prehab and just went through rehab. And the reason for that is when we go to POP, we invest before, when you're stronger and you can make the gains, you can eat, you can exercise. Whereas after surgery, you've got an incision, you're tired, it's been a big stress on your body. So to expect yourself to make the gains and become stronger, to recover faster, has that big obstacle. So that's why we really frame it as an investment. You invest, you do the work now so that afterwards you don't have to do so much.
I have to say majority of people do commit and do follow and do appreciate, and they see the differences and they see the progress. And then some other people become more emotional or some are upset. Why? Because why my doctor didn't ask me to come to this clinic much before?
sometimes what happens is you get these diagnoses and then it's quite overwhelming because it has a lot of implications on many spheres of life, and then you get overwhelmed. And so we find that overwhelm is a very common theme amongst cancer patients who come to the POP. We try and take the stress of what the patient is experiencing, and we take it and transform it from an obstacle or a dead weight into a force for change.